Hi, Miss Phillips. My name is Kylie. I'll be your nurse today. I'm just going to do a quick assessment, okay? I'm going to wash my hands real fast. As I'm washing my hands, I want to make sure that I took a quick look at the room, make sure that my bed was down, my side rails were up, her collet was in reach, she had her ID bracelet on. Just take a quick look at her as far as notice if she had any oxygen on, if any IV pulls, any fluids are running. Wash my hands real fast. Okay. As I do my assessment, I am going to do a head to toe assessment, but since we think that she may have had a stroke, I want to make sure I do a focus assessment too on her neurological. All right, Miss Phyllis, can you tell me your name and date of birth? And as she does that, I'll make sure to check her ID band. Okay. Can you tell me where you're at? Nope, you're at the hospital now, all right? Do you know what today is? Okay. I'm just going to take a quick look at your eyes, okay? Can you just stay and look at me? I'm going to look at her pupils and see how they are dilating since we think she had a stroke. Make sure they're not sluggish. Excellent. Can you smile for me? Good. Can you stick out your tongue? Good. With this, I'm going to make sure there's no unevenness in her face. Make sure there's no drooping. Like I said, since we think she had a stroke. Can you turn your head that way? All right, and towards your right. Just want to make sure and look at her. Make sure there's no JVD, which is perfect. Just gonna feel her skin. Her skin is nice, warm, and dry. Feeling for edema, no edema in her arms. Can you squeeze my fingers? As she's squeezing, I want to make sure that they're both even, her right and her left, bilaterally. All right, can you pull towards you? All right, and push. Excellent. Once again, I want to make sure that's even because we think that she had a stroke. I'm going to notice that she does have an IV in her right forearm, and she also has one in her left hand from the nursing home that she came in. All right, I'm just going to listen to your lungs real fast, okay? Quick listen to her lungs. Just nice, slow, deep breaths for me. Alright, I'm also going to listen to your apical pause real fast right here. I want to make sure that I listen to your apical pause for a whole minute. Okay, so I listened to that for a whole minute and I got 70. Since I also have my stethoscope on, she's on her back, I'm going to go ahead and listen to your bowels, okay? I'm going to start in the lower right quadrant and go up. And then over to the left side and go down to the left lower quadrant. Just going to feel your belly really fast. Make sure I feel her belly. Is that sore or tender or anything? Good. When was your last bowel movement? Do you remember? This morning? Excellent. So no tubes, no nothing on her abdomen or dressings. I'm just going to go down real fast. And I'm going to check her legs. No edema in her legs either. No sores, no nothing. I'm going to check her pulses real fast. Pulses are strong and bilateral. Capillary refills are excellent. Less than 3. All right. Can you pull your feet up towards you? Excellent. And push. Excellent. While she does that, I want to make sure those are equal too. Since I forgot to do her pulse and her wrist, I'm going to do that real fast, which are even and strong. Capillary refills are excellent, less than 3 on her hands. All right, hon. Can I have you sit up real fast? We'll get her on the edge of the bed. Bring my stethoscope and listen to her back real fast. All right, hon. Can you take just slow, deep breaths? And listen to her lungs on her back. Her lungs are sounding clear. So I'm going to go on her side real fast. Lift up your arm. Make sure listen that side. Other arm and listen to your other side. All right, hon. Go ahead and lay back down. Ms. Phillips, have you had any cough or anything recently? No. Are you in any type of pain? She just said her no pain for her right now. It's just she's really confused. So, like I said, I did a head to assessment, and I also did a kind of focus assessment to check her mouth to make sure there's no drooping. I checked her push and pulls, make sure they're bilateral, her squeezing, make sure they are even, and all that was even. So I make sure I would document that in the correct format, the date and time, and everything.